Hello and welcome to Random Topics with Jack, the podcast where we explore the intriguing and sometimes controversial topics that shape our understanding of the world. Last time we uncovered the secrets of colour psychology, and it was a truly illuminating experience. This week, however, we are venturing into the shadows of medical history, exploring practices that were once commonplace but are now considered unsettling. Prepare to be surprised. We'll uncover the ancient practices that might make you squirm, like the surprisingly popular use of leeches, and some ancient remedies that are, let's just say, a little sus. Get ready for a wild ride through medical history, from ancient Greece to modern marvels. Let's get started. Our medical time travel adventure begins in ancient Greece, the birthplace of Western medicine. Forget magic potions and angry gods. Meet Hippocrates, the father of medicine. He revolutionized medicine by emphasizing observation, actually looking at the patient and their symptoms. This focus on empirical evidence, a cornerstone of modern medicine, was revolutionary. He is also credited with the Hippocratic Oath, a foundational ethical guide for physicians. While its exact authorship is debated, the Oath's core principles, patient confidentiality, do no harm, and the commitment to patient well-being have resonated through millennia. So let's delve into the specific clauses. The promise to keep patient information confidential, the commitment to not intentionally harm patients, the dedication to providing the best possible care. The Oath's impact on medical ethics is undeniable, shaping the doctor-patient relationship for centuries. However, its interpretation has evolved alongside medical advancements. Modern ethical dilemmas such as end-of-life care, genetic engineering, or the use of AI challenge its original tenets. Beyond the Oath, let's examine Hippocrates' medical theories, including his famous four humours: blood, phlegm, yellow bile, and black bile. While inaccurate by modern standards, this theory profoundly influenced medical thinking for centuries, shaping diagnostic and treatment approaches. Let's explore a specific example of Hippocrates' diagnoses and treatments, comparing them to modern practices. For instance, how did they handle fractures? They used splints and bandages, and often relied on rest and observation. What about fevers? They recommended rest, fluids, and herbal remedies. Let's look at a specific case study. Hippocrates' description of a patient suffering from pneumonia. He carefully documented the symptoms, cough, fever, and difficulty breathing, and made a prognosis based on the severity of the symptoms. His treatment was focused on supportive care, such as rest, fluids, and avoiding strenuous activities. Hippocrates' emphasis on careful observation and natural remedies laid the foundation for evidence-based medicine. Now fast forward to ancient Rome, and we meet Galen, a physician, surgeon, and philosopher whose impact on medicine was both profound and problematic. Galen's brilliance lay in his detailed anatomical studies. Through his reliance on animal dissection, primarily pigs and monkeys, they led to some inaccurate conclusions about human anatomy. He made significant contributions to understanding the circulatory system and nervous system, yet his flawed anatomical models persisted for centuries. For example, his description of the circulatory system, while incomplete, was a major advancement. His work on bloodletting, however, became a standard practice for centuries despite its harmful effects. Let's examine a specific aspect of Galen's work that was later proven incorrect, and how these errors impacted medical practice for centuries. Galen believed that blood was produced in the liver and consumed by the body. This incorrect model led to the widespread practice of bloodletting, which was believed to balance the humours. The general practice was often ineffective and sometimes harmful, but it persisted for centuries because Galen's authority was so great. His anatomical descriptions, though sometimes inaccurate due to his reliance on animal dissections, provided a foundation for future anatomical studies. His writings were meticulously detailed and became the standard medical text for centuries. Galen's legacy is a complex one, highlighting both his significant contributions and the limitations of his methods, but his impact on medical practice was immense. And the Middle Ages present a fascinating and often unsettling picture of medical practices. The rise of barber surgeons, a bizarre combination of professions, is a prime example. Imagine getting a haircut and a leg amputation in the same place. This practice reflects the limited specialisation and the overlap of trades during this period. Then there's the iconic plague doctors with their creepy bird-like masks. The masks filled with fragrant herbs were intended to protect against the foul air believed to cause disease. The Black Death, a devastating pandemic, dramatically impacted medical understanding and practices. Let's examine a specific example of medieval medical treatments, including bloodletting, which was still prevalent at the time, herbal remedies, and the use of charms and amulets. Bloodletting, based on the humorous theory, was common treatment for many ailments with little to no benefit. Herbal remedies, some based on ancient knowledge, were used to treat various conditions. Charms and amulets, reflecting the influence of superstition and religious beliefs, were also employed. Despite the challenges, this era saw the development of early hospitals and the continued preservation of medical texts from classical antiquity. The transition from ancient medical practices to the beginnings of a more scientific approach later in the Middle Ages was slow but steady. The Middle Ages saw a fascinating mix of medical practices, reflecting the limited knowledge and the influence of various cultural and religious beliefs. Next up, we move into the Renaissance, meaning rebirth, which witnessed renewed interest in classical learning and the blossoming of scientific inquiry. This era saw a significant shift from the medieval reliance on Galenic medicine towards a more empirical approach. While still far from modern medicine, the seeds of change were sown. Enter Leonardo da Vinci, a true Renaissance polymath, whose anatomical drawings based on meticulous dissections were far ahead of their time. His detailed renderings of the human body revealed a level of anatomical accuracy previously unseen. He wasn't just an artist, he was an anatomist, engineer, inventor, and so much more. His anatomical sketches are some of the most detailed and accurate ever produced, and they revolutionized the understanding of the human body. His work, though not published during his lifetime, profoundly impacted the understanding of human anatomy. Then we have Andreas Vesalius, a groundbreaking anatomist who dared to challenge Galen's authority. Vesalius' magnum opus, De Humani Corporis Fabrica, or On the Fabric of the Human Body, meticulously corrected Galen's anatomical errors through his own dissections. He was not afraid to challenge the established authorities, and his work revolutionized the study of anatomy. Vesalius' detailed anatomical drawings and descriptions corrected centuries of inaccuracies. He meticulously described the human body, providing a wealth of new anatomical information. His work corrected many of Galen's errors, paving the way for modern anatomy. Let's delve into specific examples of Vesalius' corrections of Galen's errors. Galen, relying on animal dissections, had inaccurate depictions of the human skeletal system, circulatory system, and nervous system. Vesalius, through human dissection, corrected these errors, providing accurate representations of these systems. The Renaissance also saw advancement in surgical techniques, though these were still often crude and risky. The development of better surgical instruments and greater understanding of anatomy led to some improvements in surgical practices. However, the lack of anesthesia and antiseptic techniques still meant that surgery was a dangerous undertaking. The Renaissance laid the groundwork for modern medicine, emphasizing observation and empirical evidence. The invention of the printing press also played a crucial role in disseminating new medical knowledge, making it more widely available and accelerating the speed of new ideas and discoveries. And building upon the revolutionary work of Vesalius, other anatomists made significant contributions during the Renaissance. Gabriele Falloppio, for instance, provided detailed descriptions of the human ear and reproductive systems, including the structures now known as the fallopian tubes. Bartholomew Eustachius, another prominent anatomist, described the Eustachian tube, which connects the middle ear to the nasal pharynx. Rialdo Colombo made important contributions to the understanding of the circulatory system, further refining our knowledge of the heart and blood vessels. These advancements, along with the work of other anatomists, contributed to a more comprehensive and accurate understanding of human anatomy. The rise of anatomical theatres, where public dissections were performed, also played a significant role in the dissemination of anatomical knowledge. These public demonstrations allowed students and physicians to witness dissections firsthand, furthering their understanding of the human body structure. This emphasis on hands-on learning and observation contributed to the development of a more empirical and scientific approach to anatomy. The Enlightenment, emphasizing reason and scientific inquiry, profoundly impacted medicine. The invention of the microscope opened up a whole new world, allowing scientists to observe microorganisms for the first time. Antoine van Leeuwenhoek's pioneering work in microscopy revealed the existence of bacteria and other microorganisms, laying the groundwork for future discoveries in microbiology. It's explored key figures who also contributed to the development of the microscope and the impact of medicine. Robert Hooke's Micrographia, 1665, provided stunning images of microscopic structures, including plant cells. Antoine van Leeuwenhoek's pioneering work with improved microscopes revealed the existence of microorganisms, paving the way for the germ theory of disease. Leeuwenhoek's observations of bacteria and other microorganisms were initially met with skepticism, but would eventually transform medicine. The development of germ theory, primarily through the work of Louis Pasteur and Robert Koch, revolutionized medicine. It provided a scientific explanation for the spread of infectious diseases, which previously had been attributed to miasmas or imbalances in the body. Pasteur's experiments demonstrated the role of microorganisms in fermentation and disease, while Koch established the criteria for linking specific microorganisms to specific diseases. This understanding transformed public health practices and led to the development of sanitation measures and hygiene protocols that dramatically reduced the incidence of infectious diseases. Edward Jenner's discovery of vaccination provided a powerful tool for preventing infectious diseases. Jenner's observation that exposure to cowpox provided immunity to smallpox led to the development of the first vaccine, marking a significant milestone in the history of medicine. Let's examine Jenner's process in developing the smallpox vaccine. Jenner observed that milkmaids who contracted cowpox, a milder disease, seemed to be immune to smallpox. He hypothesized that exposure to cowpox would provide immunity to smallpox. He tested his hypothesis by inoculating a young boy with cowpox and then exposing him to smallpox. The boy did not contract smallpox, demonstrating the effectiveness of the vaccine. The Enlightenment brought about the development of many other important medical innovations, including the discovery of anesthesia and the development of antiseptic surgical techniques. These innovations transformed surgery from a dangerous and often fatal procedure to a relatively safe and effective treatment. The Enlightenment was a time of significant progress in medicine, with the development of new technologies, theories, and practices that dramatically improved human health. The emphasis on reason, observation, and experimentation led to significant advancements that continue to shape modern medicine. The 19th century witnessed a dramatic transformation in medicine, driven by scientific advancements and growing understanding of the human body and disease. The introduction of anesthesia revolutionized surgery, making it far more tolerable and allowing for more complex procedures. Pioneers like Crawford Long, who first documented the use of ether anesthesia in 1842, William T.G. Morton, who famously demonstrated ether anesthesia in 1846, and Sir James Young Simpson, who introduced chloroform, played crucial roles in this development. This breakthrough, resulting from the use of effective anesthetics like ether or chloroform, dramatically reduced pain and suffering during surgical procedures, opening the door for more advanced surgical techniques. The development of germ theory, primarily through the work of Louis Pasteur and Robert Koch, fundamentally changed our understanding of infectious diseases. Pasteur's experiments on fermentation and spontaneous generation demonstrated the role of microorganisms in disease, while Koch developed Koch's postulates, a set of criteria to link specific microorganisms to specific diseases. And I've identified the bacteria responsible for anthrax, tuberculosis, and cholera. This understanding had a profound impact on surgical practices. Joseph Lister, inspired by Pasteur's work, pioneered antiseptic surgery, using carbolic acid to sterilize surgical instruments and the operating field, dramatically reducing post-operative infections and improving patient survival rates. The rise of hospitals also transformed medical care. Improved sanitation, hygiene practices, and the understanding of germ theory led to cleaner and safer hospital environments. Hospitals became more organised, with specialised wards and departments, and the rise of professional nursing, led by Florence Nightingale, significantly improved patient care. Beyond these major breakthroughs, other advancements included the invention of the stethoscope by René Laennec and the ophthalmoscope by Hermann von Helmholtz, improving diagnostic capabilities and public health initiatives, such as improved sanitation and vaccination campaigns, which significantly reduced infectious diseases. The 20th century witnessed an even greater explosion of medical breakthroughs. The discovery of penicillin by Alexander Fleming in 1928 and the subsequent development of other antibiotics by researchers like Howard Florey and Ernest Chain revolutionized the treatment of bacterial infections, saving countless lives. These antibiotics became a powerful tool for treating previously untreatable infections, such as pneumonia and sepsis. The discovery of DNA's structure by James Watson and Francis Crick in 1958 using X-ray diffraction data from Rosalind Franklin and Maurice Wilkins opened up new avenues of research, leading to advancements in genetic engineering, gene therapy, and our understanding of hereditary diseases. Organ transplantation, made safer and more successful by the development of immunosuppressant drugs, offered new hope for patients with end-stage organ failure. The first successful kidney transplant occurred in 1954. Vaccines for diseases like polio, found by Jonas Salk and Albert Sabin, and measles dramatically reduced their incidence, protecting millions from serious illness and death. The development of the MMR, or measles, mumps, rubella vaccine, in particular, was a major public health achievement. Advances in medical imaging, cardiovascular medicine, including bypass surgery and angioplasty, cancer treatment, and in vitro fertilization further transformed healthcare. The 20th century's advancements, building upon the foundations laid in the 19th century, represent a period of unprecedented medical progress, dramatically improving human health and longevity. Now we move on to modern medicine, which is characterized by an unprecedented level of sophistication and precision. Building upon the foundations of previous centuries, several key areas have witnessed truly remarkable progress. Medical imaging has revolutionized diagnosis, providing physicians with the ability to visualize the human body in exquisite detail. This allows for earlier and more accurate diagnoses, leading to more effective treatment and strategies. Let's explore the specifics. So you've got medical resonance imaging, or MRI, which uses powerful magnetic fields and radio waves to create detailed images of organs and tissues. It's particularly useful for visualizing soft tissues such as the brain, spinal cord, muscles, and ligaments. The ability to differentiate between normal and abnormal tissues with high resolution makes MRI invaluable for diagnosing a wide range of conditions. Then you've got CT scans, or computed tomography, which use X-rays to create cross-sectional images of the body. They're excellent for visualizing bones, internal organs, and blood vessels. CT scans are often used to diagnose injuries, infections, and cancers. The speed and detail offered by CT scans make them essential tools in emergency medicine and critical care. Then you've got PET scans, PET standing for positron emission tomography, which uses radioactive tracers to visualize metabolic activity within the body. They're often used in cancer diagnosis and staging, as well as the diagnosis of neurological disorders. PET scans can detect subtle changes in metabolic activity, allowing for early detection of disease. And then we have ultrasound, which uses high-frequency sound waves to create images of internal organs and structures. It is a safe and non-invasive imaging technique, commonly used in obstetrics and cardiology. Ultrasound is also used to guide biopsies and other medical procedures. The combination of these advanced imaging techniques has dramatically improved the ability to diagnose and treat a wider range of medical conditions. They allow for earlier detection of diseases, leading to more effective interventions and improved patient outcomes. And we also have the rise of minimally invasive surgical techniques, which have transformed surgical practice, offering patients less pain, shorter recovery times, and reduced scarring. These techniques utilize small incisions and specialized instruments to perform complex procedures. Let's examine some key approaches. So first we have laparoscopic surgery, often referred to as keyhole surgery, which involves inserting a small camera or a laparoscope and surgical instruments through small incisions in the abdomen. This technique is used to perform a wide range of procedures, including gallbladder removal, appendectomy, removing the appendix, and hernia repair. We have robotic surgery, which uses a robotic system to assist the surgeon. The surgeon controls the robotic arms, which are equipped with surgical instruments. Robotic surgery offers enhanced precision, dexterity, and visualization, allowing surgeons to perform complex procedures with greater accuracy. And the benefits of minimally invasive surgery include, as we've covered, less pain, reduced risk of infection, shorter hospital stays, faster recovery times, and improved cosmetic outcomes. These techniques have greatly improved patient experience and reduced the overall cost of healthcare. And we also have gene therapy, which is a revolutionary approach to treating diseases by modifying or replacing defective genes. This technology holds immense potential for treating genetic disorders and certain types of cancer. Let's explore the mechanics and the process. The mechanics and the promise even. Gene therapy involves introducing genetic materials into cells to treat or prevent disease. This can be achieved by using various methods, including viral vectors, which are modified viruses that deliver the therapeutic genes to the target cells. And it has been investigated as the treatment for a wide range of diseases, including cystic fibrosis, sickle cell anemia, muscular dystrophy, and certain types of cancer. Gene therapy does, however, face several challenges, including the potential for immune responses, off-target effects, and the need for long-term follow-up. However, researchers are making significant progress in addressing these challenges, and gene therapy holds tremendous promise for the future of medicine. And then we also have personalized medicine, known as precision medicine. It is an approach to healthcare that takes into account individual genetic, environmental, and lifestyle factors to tailor treatment plans. This approach allows for more precise and effective treatment strategies, improving patient outcomes and reducing adverse effects. Let's look at its components. So, personalized medicine relies heavily on genomics, the study of an individual's entire genome, and pharmacogenomics, the study of how genes affect a person's response to drugs. Personalized medicine utilizes the genetic information, medical history, lifestyle factors, and other patient-specific data to create an individualized treatment plan. And it has the potential to improve patient outcomes, reducing side effects and lower healthcare costs. And it allows for more effective and targeted therapies, maximizing efficacy and minimizing the risks beyond adverse reactions. Now, the future of medicine is brimming with exciting possibilities, driven by rapid advancements in technology and scientific understanding. Several emerging trends are poised to reshape healthcare in profound ways. And one future technology that we talk about a lot in this podcast is how AI could fit in with whatever we're talking about. And this is no different. AI is rapidly transforming healthcare, with applications ranging from disease diagnosis and treatment planning to drug discovery and personalized medicine. So AI algorithms can analyze vast amounts of medical data, including medical images, patient records, and genetic information, to identify patterns and make predictions, aiding in diagnosis and treatment decisions. AI is also being used to accelerate the drug discovery process, identifying potential drug candidates and predicting their efficacy. AI-powered tools are being developed to personalize treatment plans based on individual patient characteristics, including their genetic profile, lifestyle, and medical history. However, the use of AI in healthcare raises ethical considerations, including data privacy, bias in algorithms, and the potential for job displacement. However, AI has the potential to revolutionize medical care and can currently be a useful tool for diagnosticians. Nanotechnology is another thing that we're seeing coming up within the medical sector, and it's the manipulation of matter at the atomic and molecular level, and it holds immense promise for medicine. Nanomaterials can be used to deliver drugs more effectively, diagnose diseases earlier, and develop new therapies. So let's explore some possibilities. Nanotechnology-based drug delivery systems can target drugs to more precisely to specific cells or tissues, improving their effectiveness of treatment and minimizing side effects. Nanotechnology-based sensors can be used for early disease detection, allowing for timely intervention and improved patient outcomes. And nanotechnology is being used to develop new therapies for regenerative medicine, with the goal of repairing or replacing damaged tissues and organs. But beyond AI and nanotechnology, other emerging trends are shaping the future of medicine. 3D bioprinting is being used to create functional tissues and organs, potentially revolutionizing organ transplantation. The development of new biomaterials is improving the design of medical devices and implants. The integration of wearable sensors and telehealth technologies are enabling remote patient monitoring and improving access to healthcare. And then there's gene editing technologies such as CRISPR, which are being used to correct gene defects and treat a wide range of diseases. Big data analytics is being used to improve healthcare outcomes and reduce costs. And while immortality may remain a distant prospect, the convergence of these advancements is paving the way for a future where diseases are diagnosed and treated more effectively, and the human lifespan is extended significantly. The future of medicine is bright, promising a healthier and longer life for generations to come. So yeah, what a ride. We've journeyed through the history of medicine, from the OG healers like Hippocrates and Galen to medical plague doctors, and then on to the pivotal breakthroughs of anesthesia and germ theory, and finally the 20th century game changers like antibiotics and DNA. We then blasted off into the future with AI, nanotech, and personalised medicine. It's like something out of a sci-fi movie. A huge thanks to everyone who listened. Next time we're diving into linguistics. We'll be looking at language families and their proto-languages. So yeah, as always, I've been your host Jack, and until next time, keep questioning and exploring.